James Alliance is a UK-based initiative that involves people in setting priorities for research. And by people, we mean patients, service users, carers, families and health and social care professionals. And it's unusual because it's normally not those groups who make decisions about what gets researched. It's normally researchers, it's normally industry. So we believe it's important to hear from the voices of the people that research is meant to benefit in order to find out what they think research money should be spent on.
Once we participants recruited to trials, how do we retain them? There's a lot of wasted effort going into recruitment of participants to trials. We need to maximise our ability to retain participants in trials. And that's why PRioRiTy 2 is such an important piece of work, trying to identify what are the uncertainties that we should focus our time, energy, funding in answering to improve the efficiencies with which we retain participants in trials.
So PRioRiTy 2 project has aimed to identify the top 10 unanswered questions for retention in trials. And then what we hope to do with those questions is to generate evidence on how to keep people in trials. And this process has worked with a range of different stakeholders, from patients and public to frontline researchers, clinicians and methodologists, with all of those people coming together to identify the top 10.
Well, it's important to me for entirely selfish reasons. As a patient and a potential patient for things that haven't yet overtaken me, I want to have access to the best information available to guide my choice of treatment option. And indeed, if there's uncertainty among various options, then I want to be given the opportunity to participate in controlled trials that reduce that uncertainty. And all of that is relevant to generating the kind of information that I want to have accessible to me to look after my own interests as a patient.
I think the day's gone really well. I'm really impressed with everyone that's taken part. Because it's different to other JLA partnerships, I wasn't really sure what to expect today, but actually everyone has come here feeling very passionate about the topic. They've got different perspectives, different opinions about what's important, but they've worked together really pragmatically. They've been very magnanimous and they've been very mindful of the people who aren't in the room. So it's been a real privilege to be involved in that discussion.